Yeah, good afternoon, everyone. Hope all of you are well. And we have decided to live stream this meeting today on YouTube as well due to some demand, and we have limited restrictions. So thank you so much, all of you, for this overwhelming response. We thought to start these regular sessions as a training and interaction. So half an hour will be training, half an hour will be interaction. I request my co-host to allow people while I'm starting this session. Thank you. So half an hour will be quickly about the discussion about the topic, and then half an hour will be the like we can interact, we can maybe discuss, you can have your queries and questions or any other additional point you all want to put across. Please let us know. Intention is to uplift the entire discussion. We started with Vijaya hemp. We will be doing more sessions on that, and today we will want to talk on emergency medicine, emergency care in Ayurveda. That is very less discussed till now as far as Ayurveda is concerned. And why we are doing this is because in our clinic we have seen so many patients and so many people who are suffering from several issues, especially kind of an emergency sometimes does not have any solution. And Ayurveda medicines have excellent solutions. We have been seeing many of them, the real case examples in front of us. However, due to lack of mechanism in terms of people getting involved in the full-time research, the scientists, the researchers, the funding organizations. So it will not be at that much, it has not been involved in that scenario that internationally we can take the entire thing. But at least at clinic level, we can start, and documenting and doing those cases at clinic level will help us in always uplifting the entire domain and understanding the concepts. And also people will start taking us serious in terms of when we are talking about emergency medicine. So without uh, like uh, getting into all these discussions, maybe we can do at the interaction level. Let me quickly go through the presentation first. uh, the brief is, see, ultimately in emergency we can do so many aspects as far as management is concerned. Today we will be talking specifically about acute pain management and some other aspects of emergency medicine. However, my request to all of you is please explore and understand in a way that we need to take it forward. And our idea is not just to just impose any information on all of you. You all are well versed learners and professionals of Ayurveda. So, with due respect to all of you, the idea is to just take some insights or just compile some insights we have what we have acquired and we have like seen in our entire journey till now. And apart from that, like let's have some in like points, the takeaway points today. And in every session we are trying to do this only, so it's like a kind of a refresher, maybe you have read somewhere, or a kind of a revision, or a kind of a thought process which we can evolve, all of you can involve. And it just, we need to focus and we need to take it forward. So the first input and the first aspect of this is schedule even. So please focus on this schedule even list. I request all of you, every time when we talk about emergency medicine, this schedule even list is very, very important. Again, one of the least practiced medicines in Ayurveda. Now people are coming up, now people are practicing, but still not that much. And I will give you three examples from Russia today. I will give three examples, and you will understand that when these herbs and these medicines, in fact, we'll be discussing acute pain management also. And in acute pain management, the first and foremost is there, the first one. So the idea here is, we did a session at All India Institute of Ayurveda recently. We did a session at Chaudhary Brahm Prakash. I think Dr. Miley has also joined. Dr. Mile was there with us in Ayurveda Emergency Yatra. So the idea was to take it from there, and now we want you, all of you, to understand that this particular list, this particular compilation of herbs is very, very important, very, very specific. You need to focus. Today, the first session will be just to share an insight, just to give you a food for thought, just to give you an idea, just to give you maybe a direction. Already, maybe many of you are already have that direction or maybe that idea, but still we are not that exploring or we are not that digging the entire ocean of shastras and knowledge we have in Ayurveda. But when we focus on these, we get to know that yes, for example, Ahifena is one of the leading painkiller in the entire world. The cannabis number four, manga, is again emerging as a very potential pain management and other aspects as well. And all the other also. Vatsana will talk about that in one rush today. Then Dhatura again. So all these Jaffal. So all these are very important in terms of when we need to understand the emergency management in Ayurveda. So my request to you is please focus on this. Along with this, you can also see the entire list where Sarpisha is there. Then there are certain other mineral origin, and you can say again that arsenic, mercury. See, in purified form, they are very good in terms of emergency management, in terms of managing any emergency, and we will understand that. For some aspects, we'll understand today. So my request to all of you is please focus on this list. Please focus on the ingredients. We will give you three examples today. We'll focus always upon the ingredients. When we redo, revise, and read the text, the shastras, we can correlate that. We can connect that. We'll try to correlate couple of things today. So that correlation helps us to determining and to understanding the fact, because in emergency medicines or in emergency management, when you say, we need to always connect and correlate with due respect to our Ayurveda fundamentals and classical fundamentals and text. We need to connect and correlate with the mechanisms and the pathologies and the interactions, or maybe the overall mechanism of handling that emergency. So we need to correlate and we need to connect. Then only it will make sense to us and to the other fellow practitioners who will allow us sometimes for their patients. So in that scenario also, please study and please revisit all these herbs and the drugs and the medicines who have one of these ingredients, one of these any one of this ingredient as one of the key, you can say, raw material or key part of that particular formulation. So let's have more thoughts on that when we'll discuss on brush specifically today. Then Siddha, again, Siddha is there, Unani is there. So almost some similar, but in their language. Now, these two papers are very interesting, which we pulled from British Medical Journal, and one is talking about Aconitum forex and another is talking about cannabis. So one is in 1884, and why I'm showing this and why we have shown this to the people who are there in All India Institute of Jyotirgam Prakash and Emergency Yatra also, that this is a legacy, this is the history, this is the information, knowledge, or whatever you want to say was there in India in 1843, you can say, the second paper. And they have taken some leads or maybe some insights and developed the entire emergency medicine in many aspects. Because when we go more and more deep and more we are digging, we are seeing that either natural or synthetic derivatives of most of the plants and most of the materials which are mentioned in Ayurveda or in Schedule E1 are specifically connected to several kinds of emergency medicines. So that is one thing. Dr. Biplav, I think no need to do the recording. This is getting streamed on YouTube also. And by the way, a disclaimer to all who are seeing us on YouTube, this is very much for only doctors, Vaidyas. Do not follow any medicine. Do not do any self-medication. Please consult a nearby Ayurveda doctor or Vaidya as well. Right. Now, when you talk about, so let me just quickly come upon with the acute pain management. I will touch upon the acute pain management today with few slides, and then we'll go back to Rush Shastra and the emergency medicine which we are dealing. I will give you 2-3 examples of our case, and then maybe we can open up the session for discussion. So the WHO is saying that for second and third step, if you see in the list, the opioids, hydrocodone, codeine, tramadol, or maybe if you see the severe or the most potent opioids, again, morphine, methadone, phenytoin, oxycodone. So all these are either synthetic or natural derivatives uh, of afim or opium. And I will be going back just a second, right? So in Schedule even if you see the first one, ahifena, is nothing but afim. So my point here is It's already there in our Shastra, it's already there in our Ayurveda textbooks. It's just that has been developed in a more scientific way, that has been developed in labs also in the synthetic form as well. But ultimately, the source and the information was there in Ayurveda. So now the entire pain management, 70 to 80% of pain management is dependent on opioid natural or synthetic derivatives as far as pain management is concerned. And again, it is getting in a form of a crisis these days as well. So opioid overdose or opioid crisis is going on. We have, I think, Dr. Bhaspati there with us. So maybe in the interaction session, we will definitely have her inputs, and she can let us know more about this in US. But as per our data and research, it is becoming a crisis these days, and people are dying due to this. And this is a huge problem right now. And again, why there is a problem and why it is getting addiction or it is getting into the form of a crisis, we need to understand the mechanism. And when we understand mechanism, we need to understand how opioid is working, how cannabis is working, how other like medicines are working, NSAIDs and all. And this is a beautiful picture of showing that as far as cannabis is concerned, NSAIDs is concerned, and opioids are concerned. Opioids are inhibiting the things, or you can say kind of a blocking the receptors. So that's why the dependency and the addiction is there, and the threshold gradually increases. And that's why the more and more dose the person needs to take, and ultimately they are dying. So that is a simple thing which you need to understand, which is not in the case of cannabis and certain other interventions as far as pain management is concerned. So my only point and my only aspect which I wanted to discuss here with all of you is, see, ultimately end of the day, we need to understand why and how each and every agent, whether it is a natural plant based or a mineral based or whatever medicine, if I can say, is working, that mechanism, that entire pathway should be very, very clear. Then only we'll be able to justify to the entire world. It is very, very simple and very, very clear. Please be clear on that. But yes, we always want to keep intact our Ayurveda fundamentals. That I'm not saying to break or maybe transform the entire Ayurveda, but the understanding should be there. And if we go deep down into the understanding, again, I don't want to make this entire cannabis session, but as we are working on that a lot. So this is one of the best painkillers or the best solution for pain management, and already mentioned in Schedule E1. And in emergency cases, I have seen within minutes, within sometimes seconds, the pain is getting relieved. And now again, when we understand about pain more, we need to understand about three types, that is nociceptive, neuropathic, centralized. And when we connect and correlate the fundamentals, we can easily understand how and why it is like helping as far as the Ayurveda solutions are concerned. I will not get into detail. The only thing which I want to make a point here is, again, the synthetic opioid and phenytoin and other are killing people. 80,000 Americans died in 2022, but cannabis have been proven in decreasing the opioid treatment as well as helping people in the pain management. So this is one of the solution which is already being mentioned in Ayurveda thousands of year back. It just we need to always focus, and there are so many studies published in NIH and other platforms where you can say that cannabis is working as far as pain is concerned. It's already being accepted. However, in Ayurveda, when we understand pain management and acute pain management, uh, apart from herbs which are mentioned in Schedule E1 Ayurveda medicines, which we have displayed today, most of them are from Agatantra and Rashastra as well. Mercury, Parad is there in Schedule E1, so that means the entire Rashas will be covered under Schedule E1. But still, I have mentioned separately. Why? Because I quoted this line when we were doing that session, that emergency management is a kind of a you can say a battle or a war in which you have to have your kavach, your shastra, and your skill to apply those shastra. So now the kavach is your knowledge, which we are gaining through these sessions. Our shastra are our medicines or maybe the tools like shalaka. If we are doing Agni Karma is our shastra. Panch Karma, if we are doing, so the Basti Yantra is our shastra. Many times I have seen Basti immediately giving relief to certain kind of pain as well, and Nasyam or other like procedures also. So these are our shastras, and hand is the Param Shastra, and the skill of using those medicines or those treatment modalities in terms of marma, in terms of agni karma, in terms of panchkarma, is the skill which we need to learn and acquire. Like for example, we personally are doing agat tantra, shastra and medicines right now in clinic, along with in some cases agni karma as well. So I'm not a trained marma expert, so I will definitely not claim that. And panchkarma we are doing in another center, not in our clinic. So the point here is, as far as all of you are concerned who are taking up this session, either student or Vaidya, please focus and please read more and more about this, acquire knowledge, acquire experience, acquire. I will share a couple of my three of my experiences with Rash Shastra and emergency medicine, and we will continue with this in detail today, as it is again the first session of this series. So we thought to have very basic aspects, not to download the entire thing at once, but to create a concept and to create a mindset. All of you should focus on schedule even, should focus on Agat Tantra and Rash Shastra. You can be a Marma expert, Agni Karma expert, and a Panchkarma expert as well. But still, medicines are the backbone which you need to understand. Herbs and medicines are the backbone which you need to understand and should apply whenever you are dealing with all these cases. So let me quickly show you now few examples which we have learned, and during COVID, prior to COVID also. In fact, this particular rus is from my college life. So I will just give you a brief, I will just narrate you a brief story which is of mine. While I was in first year of BMS, I have taken admission. I think it was around 3 4 months after that. I got fever, and I think all the medicines. My father was in an allopathic hospital, like we were living. He was heading the pathology and all. So they tried entire allopathic medicines and all, and I was only 6 months old in Ayurveda, so I was not aware in that aspect. So they tried everything, and still fever was not able to heal. All the tests were negative. All the antibiotics, antipyretics, everything has been given, and still it was like around 100, and sometimes more than that as well. And after a month, doctors were very they were scared, and I was also scared, by the way, and my family was also, why it is not going and all. And PUO, the diagnose was the final diagnose of all the top, you can say, physicians or allopathy doctors was PUO, pyrexia of unknown origin, and it was there for a month. Then one day, one of my senior, they discussed with our sir. He is no more, but uh, I always owe him this particular aspect. He has handled beautifully. So he has just given us one this name that asked him to take Mrityunjay Ras. And I started taking Mrityunjay Ras, and within a few doses, I think second or third, to be precise, third dose, my fever was like not there. And my parents were also surprised, and we continued for around 5 days, and I was pretty fine and fit after third dose. Fever never came again. And I also then read, and I also then realized that yes, as far as all these fevers are concerned, and whenever we see in our clinic as well, so Mrityunjay Ras is specifically having that formula where should wish, again, should wish means Vatsanab is there, and Vatsanab with other ingredients like Kali Mirch, people you can see on your screens, is very important in terms of handling any kind of, maybe I was suffering from some kind of infection which was not being detected at that time. And we have seen this is in COVID also and many other infectious diseases as well. That whenever we are giving, although in COVID we have used other ras more, I will talk on that as well. But Mrityunjay ras again, and it is written that ye ras mrityu rupi jwar ko har leta hai, means any kind of jwar, and especially in PU, and when nobody is getting relief from any medicine or any, in fact, Ayurveda ras also. Mrityunjay ras is one of the ras which you should try, and honey is one of the anupan, you can say. So you can just mix it with honey. Generally what we are doing is, and we are asking all the patients also to do, and it is very effective. Never ask them to just take that tablet. So what we ask them, put that tablet on your spoon, crush that with some other spoon, and then mix it with honey and then take it. So that will be the best option to give a ras oshadi, and that will give you a very good result also. So that was one example of my life, and I, after that, I always follow this ras, and I give to many of my patients, and we are getting very good results and very economical also. Now the second one is again an excellent rus. I'm fan of this rus, you can say, because MDRs and superbugs are increasing day by day in India as well. I repeat, multi-drug resistance infections, MDRs and superbugs are increasing. I'm getting at least one in every week, you can say. And why? Because some of our patients, they have some international travelers also frequently, and sometimes in some pockets we have been now popularized, or you can say marketed, that if no one is able to treat that infection, go to this particular doctor, he can treat. So in that scenario, we're getting at least once in a week, we are getting one case. Recently, couple of cases are going on. And MDR or these superbugs, or where a simple tool that all the antibiotics and all the medicines are resistant, and no sensitivity with any drug, and culture report is increasing day by day, and infection is also there clinically, fever, pus discharge, other aspects are there. And Jamangal Rus we have seen is very good in those kind of infections. If infection culture report is like infection is huge, or like maybe uh, above permissible limits, and multiple times as well, you can always add Swanbhasam, Hirak, or other, depending on the patient, depending on the case. Again, the Ayurveda fundamental should be applied. So I'm not saying that you get a case, just blindly give this. No, any medicine which we are talking right now is just giving you all a direction, or maybe sharing our experience. And we always understand, and we always ensure that as per patient we customize the treatment. But in sometimes in emergency, the problem here, it's a catch 22 situation. Now on one side Ayurveda is saying me to check the prakriti, vikriti, dosh, dushya, slotas, many things. If I have to develop the Ayurveda diagnose and accordingly the treatment. But in emergency, I have to take decisions within sometimes not minutes but seconds. So at least we have some fast acting, some first mover advantage kind of drugs, which we can quickly give till the time we can think and analyze about the case, about the patient, and at least patient is getting stabilized. So that kind of approach in emergency medicine we all should take as an Ayurveda doctor, as an Ayurveda physician. For example, for all the MDRs and superbugs, first thing I do is we start with Jamangal Ras and some other medicine. We can share the treatment protocols on each and every case with some case study examples, pre and post reports, and everything, which we'll be doing in later sessions. Today, we are just giving you an insight and sharing some experiences. So Jamangal we immediately start, and that time we utilize to analyze the patient. And but within 2 to 3 days, you will start seeing the results. Within a week, you will start seeing a very good decrease in the culture report. Still, the infection is resistance to most of them, and we have used this Jamangal during the COVID as well. So again, Sannipat Jwar, if you want to connect, you can connect with MDRs. Although one more aspect which I discussed with Dr. Rajnikant Patel, he's one of the leading, we can say, Ayurveda doctor, and Vaidya did an excellent job during mucormycosis and other like aspects also. And he also in his protocol somehow. So I'm not that expert in that, but we also have seen in mucormycosis with some cases in our clinic, and he was using that exhaustively with other drugs and other medicines, of course, as Anjan or Nasya by like when we are treating that kind of infection. So point is fungal, viral, bacterial. In many kind of cases, you can see very good results as far as Jamangal Ras. And Jamangal Ras Tatha Anjan is mentioned in our text Rasendra Sar Sangrah. You can see that it is already mentioned that if we are giving as an Anjan also, or maybe as a Nasya, so it will also help in healing the Sannipat Jwar, and it is very effective in that way. So my request to all of you, you can try this as well in the patients when you are getting. We did during COVID when we were having couple of cases as far as mucormycosis was concerned. And I request all of you can start posting your queries and questions also if you want, by the way. So we have next 5 minutes, and then we'll open up the session for discussions. I already got couple of questions in my inbox, so which I will discuss after this. So Jamangal Ras is the second one, and the third one is Trilokya Chintamani Ras. Again, I will start with the COVID, and then I will touch upon with the certain respiratory aspects which we are seeing, because कफ रोग चिकित्सा में इसको बताया गया है. कफ रोग चिकित्सा, it is mentioned in the category of कफ रोग चिकित्सा in Ayurveda. And Trilokya Chintamani Ras, we have seen very good results again during the COVID for increasing oxygen saturation for healing respiratory system and lungs, and also now. So what happened was during the second wave, I remember we were one of the leading clinic, and we were getting several cases on daily basis. So we procured, because it is a very rare medicine being manufactured at that time, by the way. So leading companies were only manufacturing and very few stock they were having. So it got exhausted. We ordered, and especially the entire new stock they have manufactured, but it took some time and it got delayed. So we uh, tried to purchase in addition. I think a good amount of stock was there, but suddenly the wave got diminished, and we were lying with lakhs of you can say stock of this location numbers, that and I got confused that what to do now, because COVID is not there. So I thought, and I started practicing this in cases like COPD, then asthma. In asthma also and in COPD, we have seen very good results. In fact, when the patients are chronic bronchitis, COPD, asthma, please start using this product with another with this rust with other medicines and other classical, proprietary, whatever formulations as per your experience you are giving to patients with asthma, COPD, and chronic bronchitis. And we are seeing very good results, very good feedbacks from the patients, and it's a regular now medicine at our clinic in these respiratory cases. And the ingredient, again, when you study, is like that only. And Hira, Swan, Chandi, in fact, along with Triloki Chintamani Ras, to the patients who were at a very critical level, we have given the Hemgar Potli, the Kupipak Rasayan. So in that scenario also, we have seen that it was very fast acting, and it was like giving results within minutes sometimes to the patients, and clinically we have seen the recovery in the oxygen saturation level a lot. So Hira, Swan, Chandi, Tikshno, I think these are the ingredients. And then Abrak, again we did a session on Abrak, we will do again in this series also, as how this is very effective in respiratory disorders. And Ras Sindoor again. So all these ingredients are connecting and correlating when we are dealing with these kind of situations, as far as acute cases in terms of respiratory disorders are there. So my request to you is, when we let me quickly just go through these three ras today. So Mrityunjay Ras, as we have discussed, PUO, and again any kind of fever, if you are confused or if you are not able to connect or correlate, at least give this as an antipyretic. It will definitely help you. Then Jamangal, again, specifically in MDRs and superbugs, please use this medicine and see the improvement in the patients, because they don't have any option and they are suffering a lot. So you can discuss nearby allopathic doctors also. I used to discuss with allopathic doctors, I remember, and now they are also referring us the cases. So please discuss this, because at some point of time they are also helpless, that all the antibiotics and anything is not working, and we need to save the patient their life. So this is not about any pathy, it's just that it is working and we are getting results, and you all can try and please share your experiences. And third one is Triloke Chintamani Ras. So Triloke Chintamani Ras, I repeat, in any acute or maybe chronic case of respiratory system, please start prescribing this along with whatever strand of treatment you people are doing, and it will definitely give you. So emergency in a case of people taking several times. So I remember one typical case, they used to give the teenager kid was there two or three times sometimes the nebulizer or the puff, or that kind of respiratory distress he was. So when we started the medicines, within a week and 10 days, 7 to 8 days exactly, so the patient was having relief, and gradually in I think 2 to 3 months, the entire dependency was gone in terms of nebulizer, puffs, or other allopathic medicines were concerned. And many cases, in fact, we have revived. Initially, when I started my practice, I was not sure and I was not very much confident that we will be able to revive asthma. But now, with full confidence, we can say, and I dedicate this particular rust, Triloki rust, a major portion. Although we are using certain other medicine, I'm using one very popular Siddha medicine in that, along with Ayurveda and this Ras Oshadhi. So there are 3 4 medicines, and again, as per uh, like uh, patient prakriti and all. So we are doing that, and but still this particular ras is very specifically being positioned and being studied also, if you study this ras as well. So please understand that, and accordingly, Anupan and everything, I can, you all are well learned professionals of Ayurveda, you can follow this. So my request is these three rasas, please focus, because these all pictures and these all coverage is due to Ayurveda and Rashas. These are our contact details. So I conclude my talk here. The first 30 minutes for the talk, for the pitch, I will say, not talk or training, maybe. It's a kind of a pitch. So I think, hope you have noted down email ID or number. You all are connected through us on website as well. Great. So it was a pitch for Ayurveda. It was a pitch or discussion. For now, we will definitely take some questions and queries. And anybody wants to speak or wants to contribute or wants to share inputs verbally in audio or video, most welcome. Please raise your hand, and I will request my team to allow them as well. So let me just quickly go through the questions as well. Okay, so Jaimangal Ras and Trilokia Chintaman does kindly say, okay, so samples I will definitely request the pharma companies, the Ayurveda companies, Dr. Sayed, and they will definitely give you the samples. Very good question, Dr. Biplav. No, all patient of MDR will not be having same dose. See, again, the dose determination in MDR will depend on the culture report, first of all. That is point number one. Second, clinical scenarios and the clinical situation of that particular patient. Like I will give you two examples. So recently we got one case where the lady was a post-operative case of cholecystotomy. So the gallbladder was removed, and due to some issue maybe during the surgery, so there was some injury to the pancreas, and the pus was there, and they have drained. They have started draining through a bag, and bag was having around 200 to 50 ml of pus daily. And for around 15 days, they have given all the antibiotics, all the medicines. But after 15 days of the surgery, also, the pus was there 200 to 50 ml on daily basis, and lady and the family was very disturbed. So then I got a call. I visited her home. She was at home bedridden, and when I did the entire review and the entire thing. So, and when we studied, so around I think 4 or 5 antibiotics they have tried, and nothing was working. And they did a report also. Culture was increasing, infection was there. We started with Jamangal Ras. We started with one medicine of medical cannabis and another Ayurveda medicine. 3 medicines I have given. We'll definitely present the case study in forthcoming session in a structured way. But right now, I just want to convey here, Jamangal generally we are doing in that case, because 200, 250 ml, anything from 200 to 250 ml pus on daily basis is a huge amount. So we started with two Jamangal Rust tablets, thrice a day, 3 times. And then after a week, we did for one, 3 times. And then now she's at one morning and one evening, around 28, 29 days passed when we started our treatment. And right now she is on 5 to 10 ml, and that is also not from the pancreas. The report is clear, the scan is clear that pancreas has healed. The entire pus which was coming from pancreas was of a different color, and now it is just the local site where the bag is attached, and some injuries there as well, and the pus and the discharge is transparent and kind of a watery, you can say, not that kind of pus which is there, which was there due to the infection. So doctor also confirmed, the allopathic doctor, that yes, infection is healed now, pancreas is fine. And he was also surprised why it happened, how like you people manage. Then they discussed about Ayurveda medicines and all, and he asked that, okay, let me also connect with this doctor for other cases and other patients where allopathic antibiotics are not working. So my request to all of you is, start with whatever dose as per the body weight, gender, case, but maximum what we have given is 2 3 times a day. If infection is so acute and discharge is so huge, then otherwise one tablet BD or thrice a day is sufficient for any gold rus, swan rus, Jamangal and other Triloki and all. No? Great. So Dr. said we have noted down your like query, and will definitely request the companies to be in touch with you. Okay, the next question is, Great, very good question, Dr. Neeru. So the Dr. Neeru is asking, and it's a direct question, so it's coming to me only. The Ras Aushadhis you described were given alone. Just a second. The Ras Aushadhis you described were given alone. That is Mrityunjay Ras for PU and Jaimangal Ras for MDR. Sufficient, need other medications as well? No. See, okay. So the point here is, as far as these ratios these were concerned, I just thought to share the experience and share the information with all of you. But otherwise, the entire treatment will be there. So as I said in my session also, when like I was presenting, see, Ras Aushadhis again, depending on case to case basis. So it's a customized treatment when we do with Ayurveda. So I don't want to just do or start a practice of doing a copy paste of the prescriptions, but the fundamentals let's discuss and understand, and all of you are well versed. So the fundamental is generally one or two Swan Ras, depending on the pockets also sometime of the patient, if they can afford. Jamangal is anything from 150 to 200 or 220 rupees one tablet, so that we need to keep that in mind. So one or two maybe Swan Ras and at least one Sadharan Ras or non-Swan Ras, I can say, to start with. And then accordingly, definitely if as per the clinical aspects, we have to sometimes give polyherba formulations or classical formulations of caste Oshadis or certain kind of bhasmas or certain kind of anupan or certain kind of other balancing Oshadis also when we are practicing Ras Shastra or any kind of wish as well. And depending on the Prakriti also, we need to always determine that, and other aspects are always there. But yes, at least one or two Swan Ras and one non-Swan Ras, if you start with any kind of infections, like you mentioned about MDR definitely, and PU also definitely are one of the most challenging cases as far as infections are concerned. So at least start with two Swan Yogs and one non-Swan Yog, and then maybe after a week or 10 days, you can decrease and accordingly withdraw as per the improvement from the patient is concerned. Maximum 3 months, maximum 3 months we have given Swan Yog, three Swan Yog, three times a day, maximum to 3 months, and the reports were normal as far as the heavy metals and any other toxicity is concerned in the body of a patient. That is my clinical experience. People are practicing more also, but at least as per our Shastra as well, 3 months is an ideal time, and we have seen if we are giving good quality Swan Ras with good companies, within few days we are getting response, and maximum on an average within 2 to 3 weeks or maximum in a month we are able to get the entire healing. But yes, some cases where infection was huge, where it was from a bit long, or maybe some other factors in terms of their age or their you can say tolerance, or sometimes their comorbid aspects. It can be a bit long as well, depending on case to case basis. Maximum we have given to 3 months. Hope I was able to address your question. Any other further clarification you need and you want, please let us know. In case of infants and children, what will be the dose of Mrityunjay? Very good question again, Dr. Bhushan. See, we need to understand to each and every Rasaushadhi, let's understand in that way. Generally, they are making 125 mg or 250 mg depending on the ras and depending on the company as well. So let me just quickly give you a thought, and you can always have a difference of opinion. But as a clinician, what we have seen in kids, so I generally avoid less than 6 months, to be specific and to be honest, because in a normal OPD setup and clinic, generally we either are not getting that much of patients of that 0 to 6 months period. But yes, we are getting now 3 4 months kid, because we are treating infection, and adjacent to my clinic there are two leading pediatricians of this city, so we are getting lots of those age groups as well now. But yes, at least 6 months minimum we start till 18 years, and there can be three phases: 6 months to 5 years, till around 4 5 years is one phase, 5 years to 10 12 years is second phase, and then 12 13 years to 18 years is the third phase. These three phases generally we see, although the weight and the other aspects of any kid can be different as well, but I'm just discussing on an average. So what we do is, 18 years is an adulthood. Typically you can give, like, let's understand with Mrityunjay. So Mrityunjay, typically you can give two tablets 2 or 3 times in a day to a 60-70 kg adult. Now for teenager, that is 12 to 18, you can give 2 BD or maybe 1 3 times. For 5 to 12, you can give 1 BD, and less than 5, 1 OD, or once in a day, or half a portion 2 times is the ideal dose, which we are practicing with any Swan Ras Yog also, by the way. Swan Prashan we are giving once in a day, and any Swan Yog is sufficient from 6 months to 4 5 years. Once in a day is fine. Do not give more, because especially the younger kids are having some, they can have some issues also with the Rasas. So be cautious about that. Okay, so we will definitely take Sameer Pannag and Mal Sindur in the next session. By the way, Sameer Pannag is an excellent Ras when you are treating sciatica cases. I will give you certain insights, and this is again one of my favorite Ras, because I have used in my family. One of my relative, she was suffering during my college. Again, I got to know about this, and till the time she is pretty fine, and due to this, my marketing was there in many countries as well. So Sameer Pannak again is a very good Ras. We'll definitely discuss on this. I will be noting down this. Okay, great. So please share protocol of acute flu influenza. I think this is getting broadcast, so I will definitely note this down. This chat also I will save, and definitely we will take acute flu and influenza. By the way, we have discussed certain protocols and certain treatment modalities today as well. Mahalakshmi Vilasras is again a very good medicine when you are treating acute flu or influenza these days, along with what some Ras we have discussed today as well. So you want, you can have that also in your treatment protocols, but we'll definitely will start disease wise after this session. This was the first introductory session, but we will start disease wise. Mrityunjay Ras of which pharmacy should be used? Simple, Vaidya. You go to our website indianvadyas.com/companies. Let me just type that link for all of you here. And we have already enlisted several companies. We never enlist any company where quality is not good, right? So we have already listed several companies. You go to that page and just check the brochure of the companies, and you can order. I don't want to promote any company or any brand in these sessions, but yes, if you want, we can always one-to-one discuss, and I will at least, again, I will not be promoting any company or any brand, but whatever companies we are using in our clinic, we can always let you know that, and accordingly you can take it forward from here. Again, which pharmacy should be used for best results? See, again, so let me have in that way. See, pharmacies, all of them are good. It's not that something is good, something is not good, but yes, some companies do care, do focus on quality at a very very premium level. I again will give example of two companies to nullify the aspect here, but I will be giving, because I have used exhaustively these two companies as far as Ras Aushadhis are concerned, and other companies are also good. So I'm not denying that other companies are not good, but maybe we have used this, and this is also a kind of a bit economical to the patients as compared to too expensive brands. So patients at least can take. So quickly, Dabur and Jhandu. Now Dabur again has improved a lot. Significantly, they have improved, and they are not that expensive still, and results are very good as far as Swand Ras Oshadhis are concerned. I repeat, the Swand Ras Oshadhis, if you can try it and if you can use, the results are pretty good. And Jhandu also, especially their blister packing is very much like you can say patients are very much liking that. Mahalakshmi Vilasras, I remember when we started giving in blister packing of Jhandu, so patients are very happy. They can easily carry that. They can easily take that, or maybe cut and give some to, like it is acting as an antipyretic or antiviral or that kind of medicine. So generally, people are distributing among their family as all as well. And blister packing is easy to do that. So these were the, but quality is also good, by the way, and rates are also not that too expensive. So these two companies we exhaustively use in our clinic, and some other companies are also there. So I'm not denying to any other company. Great. Can Jaimangal Ras be used in 7 or boy with recurrent tonsillitis? I came across this patient yesterday. Allopathy doctor advised surgery. What will be the dose? See, recurrent tonsillitis, Jamangal can be one of the RUS, Dr. Suman Ahuja, but the entire treatment protocol should be planned. So I request you please connect with me directly for this case. Let me understand and let me share my inputs. We have managed and we have healed several cases of recurrent tonsillitis in our clinic easily. There is an entire treatment protocol, not only with the medicines, but with the diet and lifestyle also. And we can definitely avoid surgery. We have avoided hundreds of surgeries, you can say right now, in last couple of years, as well as recurrent tonsillitis was concerned. Because prior to COVID, we were doing Ayurveda practice in fertility, in sexual issues, in female health issues, in all those issues. We were doing emergency and infections at that time, but COVID, in kind of a COVID management, made our clinic very popular in terms of infections and especially in the kids and younger population. So now many patients from 2021, in last 3 years, many patients are coming for recurrent tonsillitis, and we were able to bypass surgeries. In fact, not in tonsillitis, adenoids also. So it can be easily managed with Ayurveda. Yes, UTI also, Chandraprabhavati double strength we are using these days, along with the Ras Aushadhis and some good, very good, in fact, syrups and alkaline model you need to understand for UTIs, Dr. Bhushan. So I repeat, Ras Aushadhis, Chandravati DS, then some syrups and the alkaline model. So we'll have a session on UTI, that how we are managing that, and we are getting very good results. Cranberries are also very good, by the way, when you are managing UTI. And several companies have started having medicines, like one ingredient, the extract or the concentrate of cranberries in the medicine, but fresh or maybe processed juice or cranberries are also fine if patient can afford. I'm just giving one example. There are so many other herbs and other fruits also, by the way, which you can use in UTI these days. Okay, so Bhanga and Hifen is prohibited in Gujarat. Can we use any other Ayurvedic medicine? So Vaidya Upendra, Bhanga is not prohibited in Gujarat, by the way. The raw Bhanga can be, but the medicines these days, company have the free sale certificate to, uh, they are able to sell across country, and many doctors in Gujarat are practicing medicines prepared from Bhanga as far as cannabis is concerned. We can have a discussion on this on one-to-one basis. Please ping me directly. I've shared my number and email ID. Let me just put it in my chat box also, so that all of you can note. This is my number and this is my email ID. So all of you can connect directly. Please let me know about this, and we'll definitely give you the regulatory and the legal documents to enable you to practice in Gujarat, because several doctors are practicing and there is no issue. Yes, Bal Rogantakras is also very good. Excellent, Dr. Bhushan. And definitely, I agree with you that it can definitely heal. Why Ifen containing medicine are not available in market? See, thanks to the pharma cartel and the other reasons, it has been diminished from Ayurveda, but it's already available in all the leading painkillers and other medicines in other pathies. Anyways, so thank you again. I think these were all questions. So hope these sessions are making sense to all of you. Hope we were able to create some insights or maybe some directions or some thoughts, so that all of you can think and include these aspects in your practices. Please do share your feedback on our social media, Instagram, Facebook, LinkedIn, wherever you want to. You can write an email to me as well. I've shared my email ID, because these feedbacks and these reviews are very important to make people aware that at least these type of sessions should be there, and I need more interaction and more involvement from all of you in future, because that will again help us to maybe understand and maybe kind of have a regular discussion on this. So thank you so much again for joining. Next week session is very important. You all can note and registered to this. the Vijaya, there are two categories of medicines in our country. One is the classical medicines like Triloki Vijayavati, Mahakameshwar Modak, Jati Faladi, Trishandi Lo, Bilwadi, Sarvagandhavati. So all these are the classical formulations. And then we have the proprietary or patent formulations in which extract, capsules, tinctures, patch, pain oils, hemp seed oil, hemp seeds, many other. So how to balance and how, first of all, how to understand classical and proprietary patent, then what kind of medicines we can use, where they are available, what are the legalities. So we will be doing all that in the next week. Specifically the classical formulations, how many classical formulations are there? Around 200. How many are available in market? We will let you know in the next week session. How many proprietary or patent medicines are there, and what potencies and what exactly the criteria, and which are the companies who have those medicines, and can we practice that legally or not. So definitely we will have both discussions in the next session. So we will be shooting the entire information on our Instagram broadcast channel, as well as we have a dedicated WhatsApp number also. Maybe all of you are getting message from that number. So we'll be sending you the registration link and the information about that next week on Saturday. Please do join us for that as well, and keep writing us and keep informing us if you need any more topic or any more specific. Like I have got a couple of suggestions today, so we'll be doing specific sessions on those topics also. So please let us know if any other topic you want to have. And we are also bringing senior gurus, RAV gurus, senior Vaidyas. We are already regularly asking them on regular basis, and they are interested, and many of them have already there on our platform. Dr. Tomar, Awad sir, many people were there in past as well, and many of them will be joining soon. Many will be first time coming live on Instagram or maybe social media or digitally. In fact, I requested some of them. So very soon we'll be connecting you with all of them, mostly either on Insta or our social media. These Zoom sessions we want to keep with you directly, and the idea is to maybe give you these kind of insights, and let's have more discussion, more interaction in future sessions. So hope it made sense to all of you. Thank you so much again for joining. Dr. CP Shukla, great. Thank you, sir, for joining. Okay, so for acute renal pain, definitely we have the entire session on that. Please join us again on that. We'll keep you posted on that, and we'll definitely discuss this renal aspect in detail. Thank you so